morning to everyone. Thank you for joining us for the Changi General Hospital webinar forum, Cancer Rehab-olution, from Diagnosis to Remission. My name is Carming and I will be your MC for this webinar. Today, we are here to talk about something important, helping ourselves or our loved ones who have been diagnosed with cancer to get back on the path of wellness. For everyone attending today, thank you for joining us, and we hope that you will find our sharing helpful. A cancer diagnosis tends to bring about fear and uncertainty, leaving patients and their loved ones grappling with questions such as what to expect before, during, and after cancer treatment. There have been many advances in cancer treatment over the years, which has resulted in many cancers being potentially treatable or even curable. But going through cancer treatment in general can still be tough for many individuals. It can change how your body works, how you think, and how you feel. And in that light, it is highly important for patients to be empowered and prepared so that they can have the best possible outcomes during and after treatment, and even beyond, into the longer-term survivorship. And this overarching theme is the focus for today's forum, where we will explore 4 key concepts. Firstly, that of cancer rehabilitation, which has to do with getting ready for cancer treatment. Secondly, learning how to manage fatigue, one of the most common symptoms felt by cancer patients. Thirdly, discover the importance of exercising throughout the cancer journey with some practical tips. And lastly, going through some useful strategies to mitigate common challenges to our mental health. After the presentations, there will be a Q&A session where our speakers will answer some of your questions posted in the Q&A box. As this webinar will be recorded, please be reminded not to reveal any personal or confidential information. The information shared in this webinar forum is intended for general use only. Any resources, product, or service mentioned is solely for reference and to aid understanding, and does not constitute endorsement or recommendation. Please consult your doctor or healthcare professional for personalized medical advice relating to your condition if you need. Without further ado, let me introduce our first speaker, Ms. Jia Lina. Lina is a nurse clinician and an advanced practice nurse specializing in rehabilitation medicine at Changi General Hospital. She obtained her Master of Nursing degree at National University of Singapore. Her special interests include neurorehabilitation and cancer rehabilitation. Tina is part of the cancer rehabilitation care team at CGH and will share tips on how to proactively prepare for cancer treatment and address the benefits of keeping a healthy diet and being physically active before cancer treatment. Let us welcome Lina, please.
Thank you, Dr. Koh, for your kind introduction. I'm Lina. A very good morning to everyone. I hope you all are doing well. So today, I'm going to talk about the topics of rehabilitation, getting ready for cancer treatments. This is my outline. First, I'm talk about what is cancer rehabilitation. Then I will introduce you about key components of rehabilitation. Then I will talk about what to eat to prepare for cancer treatments. And then I will talk about how to physically or mentally prepare for cancer treatment. So first, let's look at what is cancer rehabilitation. So rehabilitation, look at this pin box. Look at this pin box. You see, rehabilitation, also called prehab, is the duration from time of diagnosis to the time of treatment. And these treatments can be surgery, chemo, or radiotherapy. So rehabilitation use this period of time prepare people for cancer treatment by prescribing exercise, nutrition, and psychological interventions based on the needs to optimize their health. So what's the benefits of the rehabilitation? Studies have shown that patients with a prehab will have better energy level, improve their nutritional status, also have a better mood, less anxiety, possibly also shorter hospital stays, and fewer issues and faster recovery after treatments. And they also shown that improve their quality of life. So what are the key components of prehabilitation? Prehabilitation mainly focus on these 4 areas: medical optimization, nutrition, exercise, and mental well-being. So let's look at one by one. For mental optimization, actually medical focus on control your chronic diseases like your hypertension, your diabetic, blood glucose control. So please compliance with your medications to make them under control. And the smoking and alcohol cessation also very important. Why is that so? Let's look at smoking. All of us know smoking is bad for our health and increase lung cancer. So study also have shown that smoking can increase cancer risk for other part of the bodies. So you can see from this program, this diagram. So it can cause not only lung and also mouth, upper throat, esophagus, all the way, to your livers and stomach, all this. So and also can cause some blood cancers. So stop smoking is essential, before you're going for cancer treatments. Okay, some of my patients, when I ask them to stop smoking, they will tell me, I'm smoking for many, many years already. My body cannot handle it, and without smoking. Is that true? Actually, it's not true. So look at this diagram here. Your body will react even immediately after you stop smoking. So after 72 hours, you actually can breathe better if you stop smoking, and your lung functions will improve. After 3 months, your blood circulation improves. And after 9 months, your coughing and shortness of breath will decrease, and your fatigue also decrease. After 1 year, your risk of a chronic heart disease also decreases by 50%. And if you stop smoking for 5 to 10 years, your risk of stroke and heart disease will decrease to that of a non-smoker. And risk of lung cancers also will reduce to about 50% of that to the non-smoker. So how do we stop smoking? Let's learn the way of cold turkey. Going cold turkey is one of the most efficient ways to stop smoking. Look at these steps. Let me go through with you these steps. First step, you have to display your motivation to stop smoking. So you put up your motivations like your family photos, hospital holiday posters to strengthen your conviction to stop smoking. Then you set a quick date, to go cold turkey. Pick a suitable quit smoking day, your favorite day, your birthday or New Year's that is memorable for you. That's a day to stop smoking completely, and prepare the ammunition to fight for smoking. So ammunition like you get some healthy snacks to chewing on. You also can actually help yourself to avoid the places you usually smoke on. Okay, so then keep an eye on your target quit date. Before the date, you throw away all your lighters and your cigarettes and your ashtrays. So to remember to stop the smoking completely just on the quit date you set. So if you really, really cannot stop smoking and you have relapsed, and don't worry, we have professional help for you. So you can join this quit program, actually held by House Promotion Board. So smoking-free journey that will set you up for success. They have SMS, hotlines, face-to-face counselings for you. And many hospitals also have a counselor, smoking cessation counselors for you actually to help you to quit smoking. Okay, let's look at alcohol and cancer. So alcohol drinking actually associated with up to 7 types of cancers, not only liver, but also mouth, throat, voice box, esophagus, breast, and colon, rectum. This is the one-way alcohol, how the alcohol increase cancer rates. When we're drinking alcohol, when the alcohol enter our body, enter these cells, and alcohol is also ethanol. So once they actually enter, our enzymes actually will convert this ethanol to toxic chemicals, and they're allowed to build up. And this buildup will cause DNA damage, and this damage will increase cancer risk. If you drink a lot, our body cannot break down and cannot actually convert to convert this toxic chemical to a normal one energy for our body use. Then you actually will increase your cancer risk. So this is some facts of alcohol and cancer. So all types of alcohol can increase cancer risk. Not only hard liquor, but wines or some wines, and as well as beers also study has shown actually increase the cancer risk. Even the light drinkers, only a small cup of a day also been proven to increase the risk of cancer in esophagus and breast. Alcohol may also interfere with your cancer treatments, making them less effective or worsening their side effects. So stop smoking, but stop alcohol before surgery can also reduce the risk of perioperative complications. So in general, it may be a good idea for people with cancer to avoid drinking before cancer treatment starts. So let's look at what to eat to prepare for cancer treatment. I believe this is a very common questions asking. Yeah, so we all know if you are not eating well, you will have malnutrition. And malnutrition will cause you weight loss, low energy, muscle wasting, low mood, and also will increase the risk of infection and make your cancer treatment ineffective and prolong your hospitalization. In contrast, if you're eating well, you will feel better, keep up energy levels, or maintain a healthy weight and a body nutrition stores, then you will be better tolerate treatment-related side effects, and you will recover better and heal better. So the main focus is maintain a healthy weight and a balanced intake of nutrients. So the essential nutrients are protein, carbohydrates, fats, vitamins, minerals, and water. So most important message here I would like to convey to you is eating well. Choose a wide variety of foods and well-balanced meals. So let's look at the nutritional sources one by one. So protein is essential for building muscles, healing wounds, and maintaining a healthy immune system to prevent infections. It is generally important to increase protein intake before surgery, and it has been shown to help improve your recovery after surgery. So I'll give you some examples. Examples like your meat, fish, chicken, eggs, and dairy products, tofu, doughboy nuts, as well as beans, dal, chickpeas. And look at these pictures here. So for example, if you're taking a chicken, 150 grams, you will give you 33 grams of proteins. Likewise, of your same as your white fish. And if you're taking a big egg, it will give you 8 grams of protein. So the recommended protein requirement before surgery will be in the range of 1.2 to 2 grams of per kg per day. So for example, if you are 60 kg, you will need about 70 grams per day of proteins. Please choose a wide variety of the high protein products in your diet. Please consult your health care providers if you have liver or kidney disease, or if you cannot need to restrict your protein intake. So next will be carbohydrates and fats that provide most of the energy and calories, for your body to use to function properly. So the calories need depending on the age, body size, level of activity, and health status. So examples is your rice, noodles, chapati, bread, pasta, biscuits, oats. So and also starchy vegetables like potatoes and corn. Preferable to select whole grain options. So fruits and vegetables provide your body with important vitamins and minerals and have a good source of fibers. And please eat a variety of them. So aiming for 3 or more types. Fluid is very important. A large percentage of body weight is made of water. So recommended to drink at least 1.5 to 2 liters per day of fluid for adults. So please consult your doctor if you need to restrict your fluid intake. And avoid the sugary drinks if you can. So this is a healthy plate guide developed by Harvard Medical School. So you can see the plate here. So half the plate is actually contain vegetable and fruits, and 1/4 is about carbohydrates, which you can choose whole grain will be better. And healthy proteins, choose fish, poultry, beans, limit the red meat and cheese, avoid bacons or processed meat because they are contain a high salt. Then you also drink water, tea and coffee with little or no sugar, okay? And limit your juice, 1 small glass a day. Avoid sugary drinks if you can. So here are some tips to manage symptoms related to eating problems. Okay, some of the cancer patients will experience the following symptoms like appetite loss. So some tips will give you like, you can eat several small meals a day instead of large meals. And keep snacks handy for eating at any time. Carry a easy eat snack pack in a pocket or bag. You can drink, if you really cannot eat, you can drink oral nutritional supplements like Answer Plus. If you are diabetic, please consult your dietitians or other house care providers. Bloatedness, another common symptoms. What you can do, you can drink beverages between meals rather than during meals. Avoid oily food, as fat stays in the stomach longer and makes you feel full. Cut down on foods that cause gas, such as beans, cabbage, and cauliflower. Changes in sense of taste and smell also will trouble you. So here's some tips. Serve food cold or at room temperature, and this will make them taste and smell less strong. So have some lemon drops or sour plums to help remove any undesirable taste in the mouth. For nausea, you can eat several small meals instead of 3 large meals. Do not skip meals at this because having an empty stomach tends to have nausea worse. A small amount of salty, sour food such as preserved plums will help as well. So next, weight loss, and this is also a common symptoms experienced by cancer patients. So have a small frequent meal throughout the day and eat when it's time to eat, not when you're hungry. So increase the calorie and the nutrition intake of each mouthful of food. For example, drink nourishing food like milk, soya bean drinks instead of plain water or clear soup. And if your symptoms persist, and please consult your doctors and house care providers. Next, let's look at how to physically prepare for cancer treatments. So I think most of us know there's a lot of benefits to be physically active. So before treatment, it will actually, physical active will increase muscle strength and power. You improve heart and lung function, and improve your bone health, and improve also immune functions to fight infection, and as well as reduce the risk of treatment complications. And the people will be handle cancer treatment better, or reduce the risk of low mood, anxiety, of course, and eventually will increase your confidence to fight cancer. Then people will ask me, so how to exercise safely? So I will advise you to ask yourself 3 questions. Do you exercise regularly? If yes, please carry on. Do you have a heart disease, diabetes, or renal disease? If no, please carry on. But if yes, and you do not exercise regularly, please seek medical advice before exercise. And please, if you have a following symptom, to stop exercise immediately. If feeling dizzy, chest pain, a racing heart, or breathing problems, feeling thick, and urinary back or bone pains, and urinary muscle pains, or a headache that persists and doesn't go away. Yeah, so this is a symptom which is to alarm you to stop exercise. So general tips to start exercise safely. To start slow, gradually build up. Avoid the uneven surfaces and activities that increase your fall risks. Well, wear the fitting walking shoes, and drinking plenty of waters so you don't get dehydrated. You can have a healthy snack after exercise, such as banana. So what type of exercise before treatment? We focus actually on these two types, aerobic and strengthening exercise. So aerobic exercise work on your heart and the lungs. So the types of exercise can be here list up: walking, running, cycling, swimming, dancing, even your daily activities. Okay, so also strengthening exercise like arm curls, arm raises, sit to stand from a chair, marching on the spot will help your big muscles on your body, like your thigh muscles, your arms, which is we will help you after the surgery, and will let you get out from the bed early. So what's the duration of the exercise? Our Singapore Physical Activity Guideline for adults and older adults recommended for aerobic exercise and for at least 150 to 300 minutes of moderate intensity aerobic activity per week. For strengthening exercise, at least 2 days per week at a moderate or greater intensity. So for intensity, we actually have 3 levels for light, moderate, and vigorous. And we're using this talk and think rules. If light, during exercise you can talk, and the sing means it's a light intensity. If you can talk but cannot sing, then will be moderate intensity. And you cannot sing and cannot talk means it's a high intensity, vigorous intensity. So last I will talk about how to mentally prepare for cancer treatment. After diagnosis of cancer, as people will feel low mood, worried, panicked, and find it more difficult to do day-to-day activities, and find focusing difficult, feel tearful, feel angry, and also feel frightened, and have trouble sleeping, and feel out of control. Remember, these feelings are all normal responses. They vary in intensity from person to person. It's okay to ask for help. This is some tips for you to mentally prepare for cancer treatment. Stay informed. Learn about the cancer treatment processes and what to expect. This will help you feel more in control and reduce anxiety. Stay connected. Reach out to friends, family for support. You can also consider joining a support group where you can connect with others who are going through the similar experiences. Stay active. Engage in physical activity can help reduce stress, anxiety. Eating well, eat well. A healthy diet also can help you improve your mood and energy levels. So practice relaxation techniques like deep breathing, meditation, yoga. And get enough sleep. Sleep is essential for good mental health. Try to get at least 7 to 8 hours of sleep each night and keep a positive outlook. Making a positive thinking a habit. Okay, approach challenges with a positive thinking. Remember, it's okay. Sometimes not able to be, positive at all times. And what's important is that you are taking care of your mental health and doing what's the best for yourself. So this is a deep breathing technique you can learn from this diagram. So it's also called a diaphragmatic breathing. So first you belly out, inhale through your nose for 4 seconds, then hold your breath for 2 seconds, and then breathe out for 6 seconds. Belly in, then breathe out through the nose. You practice when you get anxious and you get stressed. This will help you to calm down. Okay, this is our local support groups. Some of our support groups are listed here. You can go to their website and to look for the details about how to join to a cancer support group. And a lot of hospitals also actually offer support groups. You can consult your healthcare providers to ask them how to join a support group. This is a summary slides. Rehabilitation actually targeted on 4 main areas: medical optimization. So please remember complying with your medical treatments, stop smoking and drinking alcohol. For nutrition, eat balanced diet and increase protein intake. For exercise, you perform regularly, moderate intensity aerobic exercise, strengthening exercises. For mental well-being, feeling down, anxious is normal reaction. So please practice relaxation techniques. Do not hesitate to ask for help. Thank you very much for your attention. This is my reference. Thank you. I'll pass back the time to Dr. Kwok.
Thank you, Lina, for your comprehensive sharing about the rationale and benefits of rehabilitation and its key components. Our next speaker, Dr. Neo Jin Rui, is an associate consultant with the Department of Rehabilitation Medicine at CGH. He received his medical degree from King's College London and underwent residency training in Singapore. Dr. Neo has interests in the areas of robotic-assisted rehabilitation, musculoskeletal interventions, and systems of care in rehabilitation. We will be speaking about the management of fatigue when we have cancer and debunk myths around cancer-related fatigue. Dr. Neo, please.
Hi, thank you, Dr. Kwok. So my name is Edmund. I'm one of the associate consultants in the rehabilitation medicine department, and I also run the cancer rehabilitation clinic on Wednesdays in CGH. So the topic today is on the management of fatigue in cancer survivors. When I talk about cancer survivors, this actually means patients with a new diagnosis of cancer all the way through until you have had your treatment, and in the chronic phase as you are off treatment. And in patients with cancer or cancer survivors, there is often a common complaint of tiredness, right? So cancer, we know, causes all sorts of problems for patients, right? Apart from the diagnosis and what it means for you, the implications of going for treatment, there are a lot of other things that can happen to patients during this period. For example, problems with pain from the surgery or different kinds of pain after your chemotherapy. Patients may have anxiety and depression related problems. Patients may become more sedentary, may become weaker, may not be able to move around as much. Some of you who are younger may have problems maintaining your job, and some of you also may have problems with your thinking, right? So there are a lot of different kinds of problems that can crop up during this period, and one of them, which is not very well defined, that does come up quite commonly, is this entity called cancer-related fatigue, right? And some of the patients who come in with this problem eventually, they describe being more tired than they should be, as well as the cancer affecting their life, their daily functions, their activities. And just to share about what my role is today is to talk about why patients can become very tired when they have cancer. A quick fire of 5 things that I feel are important to know about cancer-related fatigue if you or a loved one is going through this. And finally, a quick bit about what your care team and yourself can do about your fatigue. All right, so the first part, why do we get so tired when we have cancer? And what is cancer-related fatigue? Right, so cancer-related fatigue is quite different from your usual tiredness. For example, if you've had a very long day at the office and you don't have cancer, right? You come back, you're mentally drained, you're physically exhausted because you've been spending so much of your body's resources on focusing on exercise, activity, hard work. But with cancer-related fatigue, you become much more tired than what the activity would have normally caused. So patients can describe being very, very drained, out of proportion to what a normal day at the office or a normal day of doing housework would have caused them. These patients also talk about being tired for longer than expected, which means you lie on your sofa, you take a short break, half an hour later, you get up, you're not able to fall asleep, and you do not feel refreshed. So taking breaks, taking all these rests does not give you the kind of recuperation that you would normally have been able to experience on a normal day if you were not suffering from cancer-related fatigue. And this brings me into, it doesn't improve as much with rest, possibly because your rest has been fitful. You've not been able to sleep as deep and as long as you wanted to. And also partly because with the cancer-related fatigue itself, rest does not equate replenishment or re-energization. And some patients describe it as difficult to describe. They say they don't have strength, and it doesn't correspond to an arm or a leg like some of our patients with stroke would be able to describe. Some patients say, I have no energy. For some other patients, it's not even a physical thing. It's a cognitive, it's a mental thing. I have no energy to think. And some people describe it as, I just cannot describe what they're going through. They cannot describe the symptoms very well, but they are just so drained, right? So it is very difficult to explain to your healthcare providers, right? The other thing also is that with cancer-related fatigue, it is disabling, right? So if you are, say, a housewife, it doesn't allow you to carry out your chores because after you've done the meal preparation, you've chopped the vegetables, you're already tired. You don't have the ability to go on to the next step. If you are an office worker, right, you get through, say, the morning, and that's it. You don't have the energy to carry on, and it shows because this has direct effects on your life. You're not able to carry out your life tasks. And it becomes very distressing for these patients because they go into an endless loop of tiredness, poor performance, and it affects all other systems, right? Okay, and the next thing is that cancer-related fatigue is quite linked with all the known treatments. So you may be having surgery, you may be having chemotherapy, yours may be a bit more advanced, like targeted hormonal treatments. But because of all the treatments, there is a link with the cancer's demands, as well as the treatment demands on the body that causes worsening of your fatigue. There can be other factors. For example, if your blood counts are very low, your red blood cells are very low, they're not able to transport oxygen all around your body to the cells that need it. You may be on hormonal medications that change your body's hormonal balance. You may have loss of a good sleep-wake cycle, right? Like I was saying earlier, you may try to take a nap, but it's not restful. And it also worsens the fatigue, right? Some patients, we do know that patients who are on treatment with cancer are at higher risk of getting infections, and you may be having some kind of infection in your body that also makes it difficult for the rest of your body's resources to cope with your daily demands because they're so involved fighting other infections. And also, it can be caused by emotional changes. If you get into a loop of fatigue, low performance, reduced expectations, and low mood, it can continue to cycle and it can cause your fatigue, the perception of the fatigue, to be a lot worse. And there are many, many more causes, a lot of which we may not know very well yet. Right? And chronic survivors are also not spared. So some patients, you may be off treatment, you may have completed your surgery, your chemo, and you're just taking chronic hormone treatments for maintenance, or you may not even be on hormone treatments anymore. These survivors can also realize that they have fatigue in the long run. Right? So what it sounds like, a lot of patients say, I cannot find energy to eat properly, even though, doctor, you've been telling me to eat well, eat a balanced diet, maintain sufficient calories. I cannot eat well, and I cannot find the energy to get myself to eat because eating is tiresome, so I might as well rest. Some patients say they cannot meet their friends, and to them that's important. Some patients say that they don't even have the energy to even get out of bed, right? What do you even mean by daily activities? I don't want to get out of bed because I cannot sleep properly. I cannot even get around my house. And I'm so weak, I'm so tired that I cannot stop myself from falling. And that's why I'm in bed. And this, as I will describe later, causes a lot more problems with the fatigue and the weakness. Right? Some of you are parents. Some of you are caregivers. We are not patients in isolation. We are patients in a certain life role, a social role. So looking after someone dear to us also becomes a problem when we ourselves turn into the patient, right? And of course, Lena has talked about exercise. Shiva is going to talk a bit about exercise later, and surprise, I'm going to talk about exercise in a bit as well. So healthcare providers, we nag patients a lot about exercise, and it's not a great thing if the patient is not able to exercise. So what's the point of nagging a patient or talking to a patient about, all the exercise prescriptions, what a good protocol is, how to start, when the patient is simply not able to find the energy to exercise? So this becomes a problem if you have fatigue, and even if you don't. Right? As I mentioned earlier, some patients may have difficulties with carry on with their work or carry on with their career. And finally, fatigue also makes it difficult for some patients to get to the hospital, to get on with the next chemo cycle, or your oncologist may realize that your functional status is so poor that it may be starting to be risky to give you your next chemotherapy cycle. So there are a lot of impacts on a patient when they develop fatigue. Right? And this, of course, is another question that I hear from my patients. Why didn't I hear about fatigue earlier? Why didn't anybody tell me that this was going to happen? Right? Based on studies, we know that a good amount of patients have it, but symptom recognition is insufficient because fatigue, like I mentioned earlier, is very difficult to describe. So you may have fatigue, you may not know it. You may just go, I'm a bit more tired. It's because, I've had to travel to the hospital for chemo. It's because I'm recovering from surgery. So patients don't really recognize the symptoms very well. And when patients are not able to recognize their symptoms very well, the care providers also are not able to screen for it very well, because what the medics will ask, right, is, are you having fatigue? And the patient may interpret it as, oh yeah, I don't really know the full definition of fatigue, but what I'm experiencing sounds a bit different from what this person is trying to ask me. So patients don't flag it up very well. medics and healthcare providers don't really ask very good questions about it. And because of that, a lot of patients go through fatigue without knowing. Right? Medication treatment options are also very limited. So as doctors, we love to prescribe things for patients, right? Exercise, medications, other aspects. But pure medications, pure drugs for fatigue are very limited. There are not a lot of studies. There's only 1 or 2 medications that work. And even then, the side effect profile is quite severe for these medications. So giving drugs to patients, right, the pure medications, don't really work out so well. And because of that, it's not always at the forefront of your healthcare providers or your doctor's minds, simply because the prescription options are limited. Right? And often it is not the first thing that you want to focus on. You put yourself in the shoes of a cancer patient, a loved one. The first thing you're thinking of is, how am I going to treat this disease, right? How am I going to cure myself? How am I going to survive for a long time after the cancer has been taken out, after the cancer has been suppressed? And when you're realizing that you're tired, you're starting to get fatigue, it's not often the first thing that people want to think about or want to focus on, because there's so many other priorities in life. And because of this, a lot of patients end up suffering in silence and bravery, right? But that does not take away from the fact that patients do experience cancer-related fatigue. Okay, so the amount of things that can be said about cancer-related fatigue actually would probably fill a 1 to 2 hour lecture for medical professionals. But I think there are 5 things that are quite important to pass on to the audience today, right? And the first thing is it normal to have cancer-related fatigue? Right? It can be invisible. It can be a very long part of a cancer survivor's journey. So remember, like I said, cancer survivors are any people or any patients from the point of diagnosis all the way through the balance of your lives. At any point, you are considered a cancer survivor. And it can be a very, very long thing that walks with you even all the way to the end. It can range from mild to severe. So some patients, like I said, may just realize, it's been a really, really hard day at the office. It's been a lot harder than I expected. It can be really severe to the point where, I don't want to get up. I'm done. I don't want to get out of bed to see the doctor. I don't want to get out of bed to go to the toilet, to brush my teeth. I'm so tired, right? So it is normal. It is something that we get in a lot of patients, right? But what is not normal is if the other reversible causes behind the cancer or the cancer-related fatigue are allowed to continue making the fatigue worse. So, for example, there are some patients who have low blood levels, like I said earlier. There are some patients with problems with, say, your thyroid. So these are considered reversible causes. If we're able to work these up, if you're able to do the blood test to prove whether or not these are contributing to your cancer, to your cancer-related fatigue, we can then take directed treatments. For example, some patients may need a blood transfusion. Some patients may need injections to allow your blood levels to come up. Some patients may need antibiotics for the infections that are worsening your fatigue. Some patients may need thyroid medications. Some patients may need recalibration of your chemo, of your radiotherapy, etc. Right? So if there is a reversible cause behind the cancer-related fatigue, then we are able to give you appropriate treatments for it. Either your oncologist, your surgeon, or the rehabilitation medicine doctors. If we're able to find something, we are able to treat it, right? So it is normal to have cancer-related fatigue, right? But I think the important thing in this slide is how bad it is and whether or not there is a reversible cause behind the cancer-related fatigue. Some patients, some of you may be thinking now, oh, it couldn't be possibly happening to me, right? I'm not one of these guys or girls that this doctor is talking about, right? So have you noticed that if you're a cancer survivor, your chores seem to be getting a bit harder? For example, hanging the laundry now takes twice as long, requires more breaks, requires your loved one to help. Have you noticed earlier bedtimes? You're going to sleep at not just 8 p.m., but you're going to sleep at 3 o'clock in the afternoon. You're taking a 2-hour nap, you're staring at the ceiling, you're not falling asleep, and it makes you more tired. Have you noticed you're getting more irritable? For example, your spouse asks you where you want to go for dinner. And normally, you who are the one who decides, I'm going to buy this, I'm going to decide we are going out for dinner, you snap back at them, right? So you may be getting a bit more irritable. Have you noticed you're getting a bit less interest in watching the television, in going out, walks to the park, traveling, going to cafes, less interest in the things that you previously enjoyed? So cancer-related fatigue can creep up on patients, right? We have a few ways of scoring it. Different healthcare providers use different scores, but there are a lot of very, very useful skills that we use to determine whether patients are having cancer-related fatigue. And like I mentioned, the cancer-related fatigue can be very mild at the start. It can be very severe. And if you are not aware that this is a possibility, you're not going to know how to look out for it, right? So even if you don't have cancer-related fatigue currently, it's important to be aware that cancer-related fatigue can happen so that you can be appropriately treated, you can take steps for self-management, and you're able to control your symptoms as they come. So this is a myth, right? There's no hope, right? This guy said, yeah, no good medications. Why is he still talking about it? Because, you know, if it's going to happen, it's going to happen. We can't do anything about it, right? So there are actually a lot of steps that we can take to manage cancer-related fatigue. There are some things that the medical team can do. There are some things that the patients can do. But I think most importantly is how to manage the fatigue on your own terms, because it's not going to go away, but how you deal with it and how you tweak your life, how you strategize and adapt, and how you try to reduce the sensation of fatigue is going to be the game changer, right? So this is a mix of personal strategies, non-pharmacological treatments, and pharmacological treatments, or what we call medications. The condition may be mild, right? So if your condition is mild, a lot of it is about self-monitoring, taking note of what has changed, when things are starting to change. As I mentioned before, we will talk about exercises. And as the condition progresses, as you get more fatigue, then things like cutting out medications that contribute to your fatigue and implementing strategies for conserving your energy may become important, right? You may have low nutrition for some of the reasons that Lena mentioned earlier, and you may need tweaking in your diet so that we are able to improve your body's energy sources. Some patients find that things like yoga, massage, acupuncture help, and these are things that, especially in the Western countries where they do a lot of studies on this, and have a lot of access to things like yoga and non-Chinese, non-Malay, non-Ayurvedic kinds of massage, they're able to access. Right, things like cognitive behavioral therapy, counseling, treatment of the mood are also important. And as the cancer-related fatigue becomes a bit more severe, right? It doesn't mean that your fatigue is severe, it means your cancer is severe. Sometimes patients may have mild cancer, severe fatigue, right? We talk about, in those cases, psychostimulants. So some medications that we can give you a burst of energy. It can give you that energy, that attention to allow you to prioritize the activities that you consider important, right? We can also send patients for things like bright white light therapy, or help them to find a bright white light source that you can buy from, you know, like Lazada, Taobao, Shopee, that allows you to regulate your sleep-wake cycle a bit better, to improve your sleep and then improve the amount of restfulness that you get from the sleep, right? And then, of course, symptom control. If the fatigue itself comes with a lot of the other things, as some patients have a bit more advanced cancers, treating those other symptoms can also help to reduce the sensation of the fatigue, right? So this one a bit of a preemptive answer, because some patients will ask this, and a lot of patients have asked me. No supplements or herbs are known to work for cancer-related fatigue specifically. Vitamins, yes and no, only if you have certain key vitamin deficiencies. Treating those vitamin deficiencies can possibly improve your body's, your systemic energy, and allow you to have the resources to do other things. So if you have a vitamin deficiency, right, that is proven on blood tests, that is worsening your fatigue. This is one of the reversible causes I was talking about earlier. This can actually help to improve your cancer-related fatigue. But otherwise, there are no supplements or herbs or general multivitamins, health vitamins that are known to work. So is there no hope? No, there is hope. Okay. A lot of patients tell me this also: I fatigue, I'm tired, so I must rest, I must sleep, right? If I don't sleep, how can I get better? How can I get stronger? So yes, certain friends, right? Certain animals like koalas, they hibernate, they sleep a lot, they get stronger, they are conserving energy. But actually, the quality is important, right? So what we find, or what is well known, is that patients with cancer-related fatigue actually spend a lot more time than normal trying to rest, trying to sleep. But trying to rest and trying to sleep does not mean that you're going to improve your energy stores. So having disrupted sleep definitely changes the quality. And some patients stare at the ceiling or sleep for about 20 minutes, wake up, stare at the ceiling again for another half an hour. Your sleep quality is not good, and your sleep latency, how long you take to get to sleep, is not good, right? So the usual response, right? Since I didn't sleep so well, I must sleep more. It doesn't really work. So oversleeping is not helpful. It cuts down the amount of time you have in the day. It messes up your body's internal sleep cycle. And every time you sleep, it does not replenish you the way you hope to. So what's useful? Regular patterns are, right? If you're the kind that has learned to start to take naps because of your fatigue, try to stop with the naps in the afternoon, because if you're having afternoon naps, it's going to recharge you a bit. But by the time you go to sleep, you're not going to need the sleep. And because of that, you don't fall asleep as well. You don't fall asleep as fast, and you don't sleep well. So having regular patterns is important. Good sleep hygiene. So some patients say, you know, after dinner, I met a lady who was like this just last month. She said, I take tea and coffee after dinner because I need that energy at night to text my friends, to do my things after work. But what she didn't realize is that when you're taking coffee and tea in the evening, you're actually putting all the caffeine and tannin inside your body at the wrong time. And when you eventually need to sleep a few hours later, you still have all this caffeine going around your system, and that's not good for trying to fall asleep. So when we talk about sleep hygiene, it means things like, you know, only limiting your coffee and tea intake to at best after lunch, trying not to take any more after that, trying to sleep in a dark area, free from any distractions, you know, no sleep music, or if you are playing music to help you relax, set a sleep timer so that the music doesn't continue on at 3 a.m. And you know, some people use Spotify at 3 o'clock, suddenly they give you an advertisement very, very loud, and then that wakes you up. So sleep hygiene is important because good sleep hygiene generates good sleep quality. Stimulus control. So like I mentioned earlier, caffeine, tea, and music volume, things like this will contribute to sleep hygiene. Right, there are some patients who come in with fatigue, and we are able to identify that they have a problem with sleep, for whom bright white light therapy may work. So this is actually just a light that you expose yourself to in the daytime for a short while, that tricks your body into thinking, okay, this is where I'm going to set the reminder that this is the morning. So it helps to regulate your sleep rhythm, your body's internal clock, and that allows you to have a better sleep at night. But this doesn't work for every patient. For example, if you don't have sleep problems and your fatigue is because of other issues, then this may not work for you. So resting more does not mean that your cancer-related fatigue will improve, right? Important thing from here is the quality of how you sleep. Okay, and like I mentioned earlier, right, this guy is crazy. He's telling me you're tired, exercise more. How do you even start? Right, and just now Sister Lina was showing 150 minutes of aerobic exercise. If you divide that by 5 weekdays, that's half an hour of running around, half an hour of jogging. That's crazy. How are you going to do that? How are you going to do that, right? Even the doctor probably doesn't do that. So what we do know actually, and this is something that Sister Lina talked about earlier, is that of all the medications, of all the treatments, of all the things that we can do for cancer patients, or all the things that patients with cancer yourselves can do, there is a very, very strong link between physical activity, exercise, and improvements in your cancer fatigue, right? So this slide here, it is a medical facing slide, right? A lot of the details are for us to be aware of, but what I think is important for patients to know is that of all the medications that we can give, exercise has one of the best and strongest evidence bases for improving a lot of cancer-related problems, right? I say again, strongest link among all the drugs and interventions that we can give for cancer-related problems. So things like fatigue, things like your anxiety, your mood, for patients with breast cancer, lymphedema, very, very strong evidence. So if you are able to improve your level of activity, and we're not just talking about, you know, walking, we're talking about actual exercise like was described earlier, you will be able to improve a lot of aspects around your cancer apart from the cancer itself, right? Of course, there are a lot of things to be careful about. These were mentioned earlier already. If your bones are involved, you probably will need somebody to tell you how to exercise safely. For example, if the cancer has gone to your spine, you don't want to be doing twisting exercises. You don't want to be doing jumping, plyometrics. You don't want to be doing large, forceful twisting things that can destabilize a bone that has cancer inside. If your blood levels are low and we have certain guidelines, for example, if your platelets are too low, you don't want to be doing things that cause blood vessels to burst, right? Even small capillaries in the skin. So you don't want to be doing high energy strengthening exercises with large weights that you've never tried before if your platelets are low, because the bleeding can be massive. If you have infections, of course, we don't want you to be spending your body's resources at this point doing things like high intensity exercises while your body is trying to fight a severe infection, because you're confusing your body about where you want the resources to be allocated. And if you're a patient who falls very easily, or you're a high-risk faller, for example, your chemotherapy has caused numbness in your hands and feet, you don't want to be the kind who is running around without any precautions or safeguards, because if you fall, that sets you back many, many, many steps. Right? So exercise helps to improve cancer fatigue. Fact. But how to start? Right? This guy has been talking so much, and later people are going to talk a lot more about exercise, but I'm not even getting out of the bed. So how do I start? Right? So this slide we have seen before, just to highlight again, Singapore Physical Activity Guidelines, the government is starting to focus on this as part of wider population health. So these are things that in general, the whole nation needs to do better, not just patients with cancer. But for a start, there are very important things here for patients to take away, especially if you are a cancer survivor or if you have a loved one who has cancer, right? If you're already jogging, jog longer, jog faster. If you can't jog, try brisk walking. And don't just do brisk walking like my mom does, in which she just walks a bit faster and can still play games on the phone. Try brisk walking to the point where you find yourself getting breathless, right? Like Sister Lina said earlier, moderate intensity, right? So push yourself a bit, right? Some patients cannot walk far, right? So walk a bit, walk until the point where you do feel tired and breathless. Some patients cannot even walk, right? So if you can't even go down to the park, are you able to do static pedaling? Are you able to, for example, get a cycling machine from Decathlon, Taobao, wherever? If a cycling machine is too expensive, are you able to buy one of those small pedal cycles, triangular with just pedals, so that you can put it on your dinner table or put it at the sofa? And when you're sitting there watching TV, trying to revitalize yourself, are you able to just do short pedaling? If you can't even move your legs, like some of our patients, right? Sitting up also stresses the heart. Sitting up helps you to improve the control and the strengthening of what we call the postural muscles. So sitting up is also a form of exercise, but only for patients who are not able to move, right? So how to start really depends on your current level. If you're already at a certain level, push yourself a bit further. And we're not saying go for 150 minutes straight away, right? Start slow. Start progressively. If you're able to go for 10 minutes first, you feel tired, that's great. Come back tomorrow, try for 10 again. Once you're feeling good at it, try 15, try 20, right? Progress gradually. If you're talking about doing weights as well, progress gradually. Don't overstrain yourself. Don't injure yourself while you're doing exercises, right? And if you're able to gradually increase this, then that actually helps with the fatigue eventually. Some patients, and I think this is probably going to be one of the questions, have certain precautions, like I mentioned earlier. Patients who have problems with the bones, problems with the blood, who are fighting infections, or who have more complicated cancers. These patients, at the start, probably not so good to try exercising yourself. It may be better to start with an exercise professional. So it's a simple Google, right? A lot of these are also available in hospital settings or in the outpatient gym settings. So for example, Healthy SG, Active SG gyms, or your hospital affiliated physiotherapists, or even your rehabilitation medicine department, all for those who are really, really much better, sports medicine even, can talk about the same thing. A lot of healthcare providers in Singapore are actually quite trained to talk about exercise, to talk about exercise prescription and exercise progression currently. So this is one of the things that is important to try and start up. Okay, and I forgot to mention earlier, if you're not able to do weights, use your body weight, right? Lean against the wall and go down slowly, do a half squat. That's also using weights to train your body's muscles already, right? Some patients, it's a very specific group, the cancer patients with nerve problems, with balance problems. For example, because after your chemo, you started having numbness and tingling, or maybe the cancer has gone into your brain, into the balance parts of your brain. You may need to have more balance training. So senior activity centers downstairs at HDB playgrounds, there are a lot of balance machines. And actually, this is one of the things that I love to tell patients, go to find those balance machines. They are not too difficult. If you can get on them, you can actually practice with them. Right? So how to start, right? It's a fact. Starting is good, and depending on what your level is, you can start and you can progress. Okay, the final section, I know I've overrun, sorry about this, is what the care team and you yourself can do about your fatigue, right? So fatigue is a team challenge. The doctors love throwing medicines at patients, right? But that's not all we do. We look for the other reversible causes behind the fatigue and we treat them. Our physiotherapists and the rest of the allied health team, they focus on things like how the patients move around, exercise planning for some patients. Occupational therapists look at how you conserve your energy, how you strategize your day, and whether or not you need assistive equipment. Our dietitians may be able to help with nutrition assessment and telling you what is appropriate to eat, what is the right thing, what is the right volume amount to eat, and how to plan your eating strategy so that you can give your body enough resources. Psychologists may be brought on because of a need for mood treatment, relaxation, so that patients may be able to sleep better, may be able to energize and recharge yourself better. Your cancer specialist nurse, depending on which department you are currently seeing, may be able to help with other symptom management. Of course, support groups like Lina mentioned earlier are quite important because they may have lobangs, right? Someone may have been there, may have struggled with fatigue a lot longer than you, and may be able to come in and say, you know, hey, I tried this, why not you try it? A lot of what we understand at the healthcare level is based on evidence, based on research, right? But we cannot have possibly done enough research to know everything. And some patients may have found something has helped for them before. For example, some herb, right? Even though I say that no herb is known to help, some patients may have found that, hey, this worked, and they share it around with their support group, and other support group members find that actually this helps fatigue. If it helps, right? It's not just what the research says. And finally, the patient, right? Why fatigue is important in the patient's context is because the patient needs to be able to tell the healthcare team what is important to me, what activities I'm going to prioritize, and what I need out of this whole range of people telling me things, doing things to me, prescribing left and right. What is important to the patient is the most important thing at the end. Okay, so as a rough template, right? If your daily activities are important to you, these are 3 Ps, rough strategies that you can find on Google also, but is usually cited by a lot of healthcare providers, right? So the 3 Ps for making your daily activities reasonable, for regaining control of your daily activities look like this. The first is planning and preparation. All right, preparing for developing fatigue, tracking your energy levels. For example, were you very tired after lunch because your body is digesting? Spreading activities throughout the day based on intensity. For example, if showering is tiring and you have the most energy when you wake up, maybe you should shower in the morning after you wake up rather than trying to do it at night before you sleep, right? Recognizing which tasks like showering, like meal preparation, make you too fatigued. Recognizing warning signs of overexertion. For example, if you have done a task and you're way too tired by the next day, as opposed to other things in your day, then this is probably one of the tasks that cause you to overexert. So you need to focus on it and break it down, right? Arranging household items in the environment. For example, if your fridge is in the living room and you keep having to walk very, very far to get something from the fridge, maybe the fridge could be put in a sensible area. Maybe before you start cooking, right, you can put the knives nearer to the cooking space so that your meal preparation doesn't involve you walking around. And that helps you to plan your activity. Avoiding overstraining yourselves, like for example, if showering takes too long because you're standing up and you're getting weak, maybe sitting down when you shower can help to avoid overstraining, right? And some patients or loved ones who are still working, are you able to negotiate with your supervisor, right? Like for me, I have to come to the hospital, I have to see patients, I cannot work from home. But a lot of patients actually, and COVID has been very good in the sense that it's allowed us to learn how to negotiate work requirements. Do you absolutely need to go into the office? Do you absolutely need to go into the workplace? Are you able to redefine your work role? So if you're able to work from home, maybe you can save energy on the commute, which goes 2 ways in a day, and you're able to conserve energy so that you can do more important things for your boss, like working, right? Prioritizing is the second P. So how do you prioritize to-do lists? For example, you have to do laundry today, you have to go to work, you have to fetch someone. Are you able to prioritize? Are you able to plan the day well so that you can choose which things you actually can do? What's really necessary? Is it really important to pick up your grandchild from school if, say there's a school bus service available? If the action of picking up your grandchild, the meaning of it to you is spending time with your grandchild, can you spend time with your grandchild in another way, right? If you get the school bus service so that the grandchild comes to your home for care while, parents are at work, you're able to still spend time with your grandchild. So planning what is really necessary allows you to prioritize your tasks. Do the heaviest task first, do the easiest task first, depending on how it allows you to conserve your energy. Changing your routines, right? So some patients say, I must go to the market, but my HDB market or my neighborhood market is 3 blocks away. And by the time I get there, I'm too tired to shop, let alone when I finish buying things. If I go with my helper, if I go with my son or daughter, even by the time we finish shopping, I'm too tired to walk back. So can you do online shopping? Right. Again, this is one of the good things that COVID allows us to do, right? You can order your bak choy, you can order your mincemeat from the comfort of your home. So that may be important. Are you able to delegate or negotiate? For example, are you able to get your spouse to help with cutting the vegetables instead so that you can focus your energy on the cooking, because the cooking requires a lot more of the skills that you have built up over your life. So are you able to delegate these tasks so that you can do the more important ones? Finally, pacing and portioning. Right? So turning a necessary heavy task into small subtasks. For example, showering may be very, very energy intensive. Are you able to wash your hair at a separate occasion from washing your body? Are you able to get somebody to help you to blow your hair after that? Are you able to use a shower chair so that you can take a break after you have shampooed your hair? Right? So small subtasks are manageable, are more manageable for patients with fatigue, and it allows you to avoid rushing. Of course, it doesn't mean that we're all Superman, right? If you have fatigue, you still need to rest. So when you rest is important. For example, after a meal, when your body is trying to spend energy to digest your food, is it a good time to rest? It may be necessary, right? Okay, so in summary, it is possible to fight fatigue, right? It can be overwhelming, and it is overwhelming realistically to a lot of my patients, but you can face it successfully on your own terms, right? By dictating when you allow the fatigue to have consequences on you. There's the importance of good sleep, nutrition, and exercise, like I've mentioned before. If you are not a patient who exercises, it is important to actually start this, because teaching your muscles that it's important to have the strength helps you to have the reserves to fight the fatigue in a task. And strategy, like I just went through, planning and preparing, prioritization, and pacing and portioning. Yeah, I've come to the end. I will take questions later.
Thank you, Dr. Neo, for defining and outlining this often vague concept of fatigue and sharing useful tips on how patients can self-manage through the 3 Ps, as well as various deliberate means of improving nutrition and sleep and being physically active. The next speaker is Ms. Tan Shihua. Shihua is a principal physiotherapist with the Department of Rehabilitative Services at CGH. She obtained her Master of Clinical Rehabilitation at Flinders University, Adelaide, Australia. Shihua has more than 9 years of experience in pre- and post-surgical rehabilitation for cancer patients. At CGH, she works with patients with respiratory conditions on pulmonary rehabilitation and cancer prehabilitation. Shihua will share on the assessments to measure functional ability, exercise prescriptions, and possible challenges during the rehabilitation process. Shihua, please.
Okay, hi everyone. I'm Shihua, and thank you, Dr. Kwok, for the introduction and a nice entry by Dr. Neo on how exercise itself can actually help fight fatigue in most of the cancer patients. So maybe I can actually go through how the cancer itself can affect the patient, and then eventually, of course, at different stages of the cancer treatment, how we tailor the exercise program according to the patient, set realistic goals, and then of course how do we actually try to tailor a program for all the patients according to their current exercise tolerance. So cancer patients before, after treatment, they actually experience a lot of physical symptoms, a lot of fatigue, vomiting, psychological distress. And a lot of the time, because of the reduce in mobility, they do experience a lot of functional decline. And then therefore their quality of life is actually greatly diminished. So it actually sometimes do affect the helpers and or the caregivers or the families as well at the same time. So then what we are looking at is maybe relationship issue, financial losses, because the treatment itself can be quite expensive, and then activity of daily living restrictions. So maybe they used to like certain things, that they used to go out often, and now they actually can't as well. So therefore it affects them a lot. At the same time, maybe the family gatherings, all these are actually also affected. So then therefore they do experience a lot of changes when they are from initially being diagnosed to undergoing the treatment itself. So at different stages of the cancer, from diagnosis to the end of life, we do tailor our exercise program slightly differently. For diagnosis, when they are actually initially diagnosed, haven't gone through any treatment or surgery, we do rehabilitation. When they're undergoing the treatment, we try to do restorative rehab while they are actually managing the chronic recurrence or when they're actually under the surveillance of after their treatment and after the recovery. Then we do supportive rehab, and then of course, if let's say the disease were to progress eventually and they reach the end of life care, then we will focus more on palliative treatment. So then we look at individual like the individual rehabilitation, the main goal, main gist of it. So in rehabilitation, we're looking at trying to find impairments that they pre-morbidly already have. So for some patients, if they do have some weakness or musculoskeletal issue, some knee pain, joint pain, then we will try to fix it before they start the cancer treatment itself, because usually the cancer treatment, it will magnify whatever existing weaknesses they already have, which can worsen their pain or discomfort. So when they reach the restorative rehabilitation phase, which means most of the patient can actually we do try to screen who has a potential to attain or achieve like a full functional recovery. Then we will try to implement a more intensive rehab program. Whereas for those who are a bit more chronic, progressive, or the doctors have already told us a little bit more about the prognostication, then we will go to a bit more supportive, maybe some maintenance exercises, simpler, no extreme like weightlifting or stuff. And then eventually, if they were to be diagnosed with or progress into the end of life stage, then we will do something called comfort care. Comfort care itself doesn't mean that we just leave the patient alone. Some of the time we, actually most of the time we do ask the patient about their goals, so that we can cater to accordingly. Because there are patients who will tell me that leave me alone. There are also patients who will tell me that I still want to go out shopping with my family member, maybe at least have a family dinner. Then we will try to achieve it as long as it's realistic. So when is a good time to start exercising? Actually, this one, usually a lot of people will ask, when I'm actually having my chemo or having my radiotherapy, should I even start exercise? I'm feeling so weak, or I'm always feeling so tired. I saw in some of the actually Q&A and comments. If I'm always so tired, should I even exercise? But the sad truth is, like Dr. Neo mentioned, the only strongest link to counter this fatigue is with physical activity and exercise itself. If we do experience a lack of oxygen to the muscles, we do hope that by strengthening the muscles, right, it improves the oxidative ability, and therefore it uses, in a simpler term, a little bit less oxygen that to generate enough energy for you to do the same activity. So anyway, most research has actually shown that it is exercising at any phase is actually very safe. It doesn't cost you any worsening of the cancer or worsening of your generic body well-being unless you overdo it. So we need to know what's the correct intensity so that you don't use up all the reserve or energy that you have, and then after that feel even worse. It's not do more the better, guys. So it's doing the correct intensity that's more important. So I think just now Sister Lina have already mentioned all the possible positive effect of exercising. So I don't think I will delve into it too much already. And then where should I start? We have to make it a bit more interesting also. We don't want, I tell you to do this, I tell you to do cycling when you actually hate cycling, I tell you to do running when you actually hate running. So it really depends on what you personally like to do. Some patients tell me, oh, I love yoga. Some tells me I love Tai Chi. I like to do and go to the park and do Qigong with other elderly, which is fine because any exercise that you enjoy, there's actually a potential higher chance of you gaining benefit from it. The social interaction, the joy of doing it actually does also reduce the fatigue level and the general well-being, to improve the general well-being. So how much time can you actually commit to exercise? I know the Singapore guideline, everyone says it's 115 minutes a week. It is tough to hit if you are currently still working or if you have other commitments. So therefore, usually we'll try to plan around the patient's original schedule. So if they're not having retired, they still have a work schedule, then we will plan it like probably sometime after work or before they start work if they are the ones that actually start work a bit later. And then we will time the duration according to it. Because a total of 115 minutes can be split according to what you can actually manage. And how much energy do you actually have? I mean, I can tell you that 30 minutes a day is probably the best, but if you only have energy to do a 10 minutes or 15 minutes activity, then whatever I'm saying does not apply to you. It's actually not beneficial because you are not able to complete whatever I've just said. I just say because I tell you what's the protocol, but actually you can't achieve it at all. So then that doesn't answer or help most of you if you all haven't, especially those who actually haven't started exercising at all before. Then I will not suggest you go for a 30 minutes straight kind of exercise because it can cause you a lot of musculoskeletal pain after that, or even more fatigue. And then it probably going to affect your mood quite a lot. So we start very small for those who haven't started yet, and then we start, or otherwise for those who have already started, we try to increase slowly from where you are now. So it's important to know where are you now. Otherwise, when you actually set the goal or when you want to design the exercise program for yourself, right, it becomes very unrealistic. Okay, so when we do exercise, we want to of course, avoid inactivity and return to normal daily activities as soon as possible after the diagnosis and the treatment. We try to take part in regular physical activity because by moving itself, it actually already starts countering the fatigue level. And later on in my slides, we do have some suggestions of what kind of housework, what kind of daily activities you can incorporate with more physical activity, to increase your physical activity actually, so that even if you don't have the fixed duration of exercise that everybody is recommending, you are at least still moving. And then we start slowly and build up the amount of physical activity over time. So things that we can try, of course, is via housework. A lot of people say, a lot of the healthcare professionals like to tell you that housework is not an exercise, but actually housework can really be quite taxing sometimes. If you're already doing, continue, but you must make sure that you do at a level that doesn't cause a lot of a discomfort or fatigue after. So if you experience even more fatigue after, then there's a very high chance you're doing a little bit too much. So what is important in doing all this housework, walking, climbing stairs, gardening, or even just walking, maybe parking a bit further away, or alighting one bus stop earlier, is actually pacing. So what you want to do is you walk and then you ask yourself how tired you are now. 0 to 10, 0, I'm not tired at all. 10, I'm super tired. So if you feel about 2, which is the descriptor for 2 is light, and to 3 out of 10, 3, the descriptor is actually moderate. So if it's 2 to 3, you are doing it correctly. Or otherwise, you can use what Sister Nina has mentioned previously, which is a talk test. So if you can still talk but not sing a full song, then that is also a moderate intensity. Try not to go into the vigorous intensity, because the moment you go into vigorous intensity and you cause a lot of fatigue, you take very long to recover. This is the same for all pulmonary heart condition patients. We do not go into the vigorous intensity because the recovery period will be super long, and then you will feel very unwell after that for a very long time. Okay, so things affecting your ability to exercise during the cancer treatment usually are the stamina, strength, fitness level, the side effect, you always feel dizzy, you always feel like you want to vomit, the type and stage of cancer itself, of course. So what we need to know, this is the Singapore guideline. I adapted this from ActiveSG. Most of the people, general adults, we suggest at least 2 times a week, but 2 times a week of 150 minutes means each time is 75 minutes. This is a little bit too much for most patients, especially those that already feel weakened while doing or after the chemo or radiotherapy. So we don't suggest you go for this 2 times 150 minutes. Try to break it up into small portion. So if you can afford daily for those who have already retired or currently not working, then that would be the best, because you can do it every day. 150 divided by 7, you actually do less than about 20 minutes a day. But if you are working, then we will try to maybe we can actually split it as well. So if it's like we're aiming for 20 minutes a day, to start with a simpler version, you can actually do 10 minutes in the morning and 10 minutes in the afternoon or nighttime, so that you don't have to do a one shot. Because you must remember what Dr. Neo said, you need to plan and prioritize, right? So then if that's the case, you only have 10 minutes of energy, then we will actually just do one session of 10 minutes in the morning. You rest enough so that you gain back whatever you have energy and strength you have lost in the morning. Then we do another 10 minutes at night. If you can only start with 10 minutes or 5 minutes once a day, start with that first. That is fine. Anything is better than nothing. So just move a little bit first, and then you slowly but your aim or your goal, of course, is 20 minutes if you do 7 days a week, or 30 minutes if you do 5 days a week. Okay, so this is the intensity of exercise chart I have. It actually tells you roughly what kind of activity is considered light, moderate, vigorous, and very vigorous. So so that y'all can put it more into context, because sometimes healthcare professional, we have a lot of jargons. We say like moderate and light, nobody knows what is it. If there are people who really cannot score the 0 to 10 as well. Because whenever I ask the pain score, I ask the Amma, 0, what's the pain, 10, how, or is it 10? They will tell me, I don't know, I will be here. So then if that's the case, right, then I hope that this some examples within each intensity can help you understand a little bit better. So vigorous and very vigorous, usually contact sports, we don't recommend. Swimming actually itself, if you do leisure swimming or just slow walking in the pool, actually that can be dropped to moderate. Once again, it's easier to check via the talk test or scoring it yourself 0 to 10. Because if you really swim super slowly, then you probably wouldn't cause the heartbeat to increase that much to reach the vigorous zone. And then moderate intensity can be considered as brisk walking, cycling, if you like cycling, or shopping. That's the best thing, right? You can go shopping, of course, air-conditioned places, not as hot. Your muscle doesn't fatigue as fast as well. You feel more comfortable. Even simple tasks like bring the rubbish outside. I mean, for new houses, old house, probably the rubbish should out inside. But for new house, you can bring the rubbish outside and throw and just walk down up and down the corridor. That's actually some very light exercises you can do as well. Okay, so this is the summary of the very complicated picture that everybody showed you just now. We aim for 150 minutes at least of moderate intensity every single week. And exercise several times a week for at least 10 minutes at a time. Anything lesser than 10 minutes, right? They did do a research and show the effect might not be as well. But once again, something is better than nothing. If you can do 5 minutes, we start with 5 minutes first. We build up the tolerance slowly towards 10, towards 20, towards 30. And then we do include some light resistance training. And Dr. Neo mentioned that we can do body weight training because a lot of people say, I don't like to go to the gym, it's very troublesome. Singapore always raining, very hard to get there. So then the simple lightweight body weight strengthening can include like sit to stand exercises, squats. That's if you don't have any existing musculoskeletal, knee, ankle, hip, back pain. If you do have, don't try it first. You need to go and seek medical advice first. So usually we'll try to get you to see a doctor, sort out what's the real issue of your pain, and then eventually they can refer you to a physiotherapy if needed. They are private. Polyclinics also have physiotherapy services. Of course, the hospitals also do have. And then you do some simple stretching exercises of at least 2 days each week. You can space them up so you can actually do 1 day of your cardiovascular exercise, your walking, cycling, tai chi, whichever. And then you can do 1 day of stretching exercise and then 1 day of strengthening, because you realize they are not only, except for the cardiovascular exercises, which is the walking one. The rest are actually just at least about 3 times a week would do. Okay, so some government programs that they actually roll out to help the population to be a little bit more active. I'm sure everyone has heard of the National Steps Challenge before, whereby you are actually encouraged to walk about 10,000 steps. According to the research or the physical activity guideline, anything above 7,500 steps, you're considered quite active. If you cannot reach 10,000, then the lower limit for being physically active is actually 7,500. Of course, they did say that 10,000 steps bring about more benefit for your physical well-being and also to reduce the fatigue level. And then there's this Healthy 365 app that we can download. This app is applicable for Apple Watch or Fitbit, or otherwise you can actually collect the HPB fitness tracker from the government themselves once you sign up for this. And if you do have a faulty or a spoiled tracker, you can actually go back there to ask for exchange. And then this can help you monitor the sleep, your calories intake, and the steps you take on a physical activity level. So Active SG Gym is fairly affordable. So I think we can use this app to buy the swimming pool entry tickets as well. It's quite convenient. I mean, they are trying to upgrade all their Active SG Gym as well with like the latest machine from Germany. Yeah, so they do have like the latest equipment, very good ones, suitable for all population. Why I say the machine is good, right, is because you can increase the weight by slowly per, like every, I think, by per kg. Whereas the old type of the gym strengthening machines, right, the weights machines, is every like £5 that you actually increase the metal plate ones. So those cause a little bit higher risk of musculoskeletal injury. So now they have upgraded their gym. It's actually quite accessible. Maybe you can try it. I mean, the last one is this Lumi Health is also something that the Health Promotion Board has been trying to suggest for, but this is exclusively for Apple Watch user. They do roughly the same thing as what your Healthy 365 will do, and you can actually track your own sleep, your activity, physical activity as well. So you can check the eligibility. You can go to the website, or otherwise you can download the app, take a look, and how is it going to help you, but only for Apple Watch user. I don't endorse any brand here, but Health Promotion Board. This is the latest Health Promotion Board app they actually came out. Currently can only be used for Apple Watch. Not sure if they're coming up with more for Android users. Okay, so with that said, thank you very much. And if you have any questions, you can post in the Q&A. I'll try to answer some of it. Thank you.
Thank you, Shihua, for highlighting the benefits of exercise throughout the entire cancer journey and sharing on the key physical activity recommendations and practical tips on starting, progressing, and maintaining an exercise plan for cancer survivors. Our final speaker for today is Dr. Lim Chao Xian. Dr. Lim is a senior consultant with the departments of psychological medicine, sleep medicine, surgery, and science at CGH. He is also an assistant professor at the NUS Yonglin School of Medicine and Duke NUS Medical School. At CGH, he serves as Director of the Addiction Medicine and Consultation Liaison Psychiatry Services. Passionately involved in medical education, Dr. Lim frequently gives talks on mental health to professionals and public, and co-edited Guide to Psychiatry in Primary Care, a guide and reference for general practitioners in Singapore. Today, he will share on common emotions in cancer survivors and give practical tips on how to address and cope with them. Let us welcome Dr. Lim, please.
Right, a very good morning to everyone, and thank you to Dr. Kok for the introduction. So today I'm going to talk about mental well-being for cancer survivors. Sometimes we think that cancer is just a physical illness and the psychological aspects may be neglected or ignored. However, fear, anxiety, loneliness, and depression, they are real. So today we are going to talk about mental well-being for cancer survivors and how to help cancer survivors to cope better emotionally. To better illustrate the mental health struggles of a cancer survivor, we are going to bring you through the story of Anna. Anna is a middle-aged working professional, and she lives with her husband and 2 children. And she has a loving family. She has always been healthy. She kept fit and she watched her diet, and all was going on well in her life. So when the news of cancer hit, it came as a shock. Why me? She thought to herself. And what will happen to me and my family? So, what does a diagnosis of cancer mean? Cancer is a frightening word, and a cancer diagnosis can affect the patient's mental health at any time, from the beginning where the diagnosis is made, through the cancer journey, and also even after the treatment has finished. And feeling overwhelmed, feeling out of control is very common when one is first diagnosed with cancer. There's a lot of information to take in and to understand. And often this leads to a lot of emotions running through the mind and making one feel overwhelmed. Feeling shocked, feeling numb, feeling angry are also very common emotions. And thoughts such as disbelief, like why me, they pop into the head. Many people also feel very anxious when they start the treatment because they worry about what happened to them in the future and how the cancer and the treatment can impact themselves and their loved ones. People would react in different ways to cancer diagnosis, and they'll find their own unique ways to cope. So coming to terms with a very stressful life experience is difficult. It's not a straightforward path, there's no right or wrong way to feel or be, but we are going to share with you what some common experiences are and how to better handle them. So back to Anna, and Anna was told that the cancer was locally advanced. It had not spread to the rest of the body. So cure was possible. However, even after the doctor's reassurance, she was not entirely sure because her mother also had cancer and passed away from it eventually. There was a lot of information taken from the doctor, and she was told she had to go for surgery, go for chemotherapy. All this made her very frightened. She could not sleep or she could not eat well. And she also had to put on a brave front in front of her children. So what are some of the common psychological responses to cancer diagnosis? So these are some of the common reactions that one might have: feeling lost, feeling low in mood, feeling tearful, worried, and frightened. So all these are normal responses. They can vary in intensity from one person to another. For some people, they may not happen as much once they have adjusted to the diagnosis, or they may just stay at a level where the person may be able to manage himself or herself. For some others, they may find that they need some extra help or support, and this is very okay. It's okay to acknowledge that one is feeling these emotions and help is needed. Because these are some of the other common psychological reactions. With all the emotions, it may be difficult to focus. One may find it hard to sleep. Sometimes one may be worrying over the cancer. One may feel vulnerable about their life, about the family, about the job, and financial security. Feeling out of control is also something one may experience. And they may start to find that sometimes these emotions may be too strong or too tough for them to cope with everyday life. So back to Anna again. And because cancer treatment is about a matter of life or death, so she decided to proceed with the treatment. She had to go through chemotherapy and surgery. The chemotherapy made her feel sick, and even after the chemotherapy was over, she found that she could not remember many things. She could no longer read her books or her movies, watch her movies, because she did not have the attention span. And all this felt very strange to her. So the phenomenon that we are describing is known as chemo brain. Chemo brain, or short for chemotherapy brain, is actually the feeling that you cannot think as quickly or as clearly as you before you did the cancer or the cancer treatment. So chemo brain, can be caused by the chemotherapy itself, but the chemotherapy is not the only cause. So there are other causes of it. So other therapies, including hormone therapy, radiation therapy, immunotherapy, marrow transplant, the surgery itself, and the complications that can arise from the cancer treatment, right, such as, for example, blood loss, infection, pain, sleep problems, side effects of the medications. All these can also contribute to chemo brain. And the cancer itself can also lead to the cognitive impairment, cognitive symptoms that give rise to chemo brain. The fact that one is diagnosed with cancer itself can lead to anxiety, it can lead to frustration, it can lead to low mood, and all these can also contribute to thinking and memory problems. Certain cancers, they can produce chemicals that affect the memory, and cancers that begin in the brain or they spread to the brain can also cause changes in the thinking. The severity and the duration of the cognitive symptoms or the memory symptoms, they can differ from person to person, but it's usually a short-term issue. Sometimes some people may continue to have some symptoms affecting the brain that affects the last for months, even after finishing treatment, but usually it goes away. So most of the cancer survivors, after they achieve remission, recovery, they will return back to work. Although some of them may face some tasks, they may require a bit more concentration, a bit more time, a bit more focusing. Others may find it that it's so challenging that they may not be able to go back to work temporarily. So if you do experience any symptoms, especially if they're bad, symptoms of memory loss, concentration problems, that make it difficult for you to go back to your job, to do your work, you do have to tell a doctor. They may refer you to an occupational therapist or a psychologist who can help you to adjust to your current job and also help you identify your strengths so that you may be able to find a new job to cope better. And here are some strategies in case if you suffer from chemo brain. So one of the first things you do is to keep track of the triggers. So what are some of the situations, like the time of the day, what activities that you do, or is it the state of your mind that makes you feel confused, make you have difficulty concentrating, make you forgetful. So being able to spot the triggers may be able to help you to avoid them. Number two, develop routines. So create for yourself some easy to follow routines in your daily life. All right, it may be helpful to have a written schedule for your plans or put it in your smartphone. So these routines include waking up, what time you wake up in the morning, taking morning medications, when you have breakfast, what you're going to do in the day, help you to cope. So it may make the important things in your daily life, all right, less make it more difficult to miss. It's also important to get enough rest, get enough sleep, because having more rest and more sleep would help to improve the symptoms that affect the brain. Also important to eat a healthy diet. All right, sometimes you may get the help of a dietitian try to help you with certain foods or avoid certain foods that make your symptoms worse. To get regular exercise, we talk about exercise can be both physical and mental. So physical exercises and much has been discussed in the earlier talks. They help you to lift your spirits. They help you to regain your strength and confidence. There's a strong link between exercise, physical activity, and your emotional state. Exercise also helps to release endorphins, right, which are chemicals, all right, in the body that help to actually make us feel better, help us to improve our mood. In addition to physical exercises, mental exercises are also important, right? So give your brains a daily workout. So for example, doing a puzzle, doing Sudoku, mastering a word game, mastering something, learning something, helps to keep your brain busy, all right? But it's important also to pace yourself, like what's supposed to be mentioned, right? Do not give yourself some tasks that are too difficult. So whether it's physical or mental exercises, right? Pace yourself, start with something that is easier, simpler, and this will encourage you. You won't get discouraged when you get frustrated. You will be able to complete the exercises. It's also important to treat yourself kindly, be patient, be gentle to yourself, because there's nothing easy about cancer, nothing easy about cancer treatment. You need some time to recover, whether it's physically, emotionally, mentally, and from all the challenges of the cancer and the cancer treatment itself. And last but not least, do be open. Let people know that you're dealing with chemo brain fog, because sometimes cancer may make you feel as if they're always asking for help and you should manage on your own. But if you're able to tell your family, tell your friends that sometimes you're feeling foggy, that your brain is not working as well, they can be able to understand that you may be able to have trouble in remembering information, and actually this will be more helpful to you, right? So so Anna suffered from chemo brain fog, and then she also put up with pain, discomfort, and the fear through the entire chemotherapy process and the surgery, right? After surgery, she also had lived with a stoma, and it was difficult to come to terms of it. So a stoma, right, briefly refers to a surgically created hole in the abdomen, all right? It's because after removal of the intestines, they need this stoma and stoma bag to remove the waste product from the body. So it's something that is typically can be discomforting. It leaves some body image issues, all right? But fortunately for her, her family was there, and with time passed, eventually she completed her treatment, and it felt rather surreal. She felt relief But at the same time, she was also anxious because she was relieved that the treatment was over, but anxious because the doctor had told her that the cancer might recur, and if it did, it will be harder to treat. She also had to return for follow-up appointments and checks, make sure that the cancer is in remission, which she faithfully did so. But what was harder was actually returning back to normal life. There was a stoma, and she also felt tired more easily. It was harder to function at work. Sexual intimacy was also more difficult. She started to feel ashamed of her body. She distanced herself from others because she felt that nobody seemed to understand her. So these are examples of what can happen to one's mental health after cancer treatment. And the anxiety and the fear experienced by many of them are very real and very common. So we know that when patients start to begin the cancer treatment, they cannot wait to finish. But after completing, sometimes you may not be really sure whether you are ready for life as a cancer survivor. So first of all, there's a fear of cancer recurrence, right? It is very common. And this fear may even remain even after years after remission of the cancer. Sometimes having some ache, some pain, or some symptom may cause one to worry that it's a cancer that's coming back. Right? The time may make this fear fade, make it go away, but sometimes it doesn't go away completely. There's also the issue of self-consciousness, because the surgery or some other kind of treatment will cause some changes in appearance. Right? There may be loss of a certain body part, there may be loss of hair, there may be changes to the skin, etc. And this may make you feel self-conscious about your body. Right? There will also be changes in the weight, or even some replacement of osteotomy, some product of surgery. They may make one feel that you rather stay at home, to be away from other people, and may cause withdrawal from friends, family, and relationships. And it's not surprising that loneliness can give rise, may occur as a result. And sometimes you might just feel that other people don't understand what they've gone through. Because they don't have experience, it's harder to relate to these people, right? Then as such, it makes one isolated, right? And when you do not relate to others, right, your friends, your families, even though they want to help you, they may not really be too sure how to do so. We also want to talk about depression and anxiety, because feelings of sadness or worry, they may linger after cancer recovery. Now, for most people, these feelings, they would fade away with time. You'll find some ways to cope with them. You cope with your cancer, you cope with the treatment, and these negative feelings go away. For some, it may not be so easy. They may become more intense. They may persist over time. And sometimes it starts to affect one's life, work, and relationships with others, right? So if this occurs, then it may be a sign that one may be suffering from depression or an anxiety disorder. Now, there is a myth, because sometimes some people do just believe that depression and anxiety disorders, they are due to weakness of the mind. And if one is being mentally strong, this will not happen to them. However, the research tells us that this is not true. All right, just by trying to push these thoughts away doesn't make them go away. All right, depression and anxiety disorders, they are also medical conditions. As much as asthma, as much as diabetes, they do require medical treatment to make one feel better. So if you're having signs or symptoms of depression, to let your doctor know, to seek medical attention promptly, and there's help for that. So like in the case of Anna, she started to feel down and depressed almost every day. She struggled to sleep, and the food seems to have lost its taste. Nothing seems to interest her, and she felt like giving up. So fortunately, she told her doctor, who referred to see a psychiatrist, and the psychiatrist diagnosed her with depression, treated her with medication and psychotherapy. And the amazing thing about the treatment is that even though the circumstances doesn't change, that she's a cancer survivor, and she still has these struggles and challenges to go through, but it no longer feels as bad. She started to feel happier. she's more relieved, and she realized that she's able to take charge of her emotions. So last but not least, we're going to share with you some tips that help you to cope better with the various negative emotions that can come. So first of all, right, to be able to cope with these emotions, you have to be honest with yourself about your feelings. You have to acknowledge how you feel, right? Try not to feel guilty. Sometimes it's easy to do so, but it is not your fault that you are feeling this way. It's not because you're not strong enough, right? So try not to just hope that they will just go away. It is better to ask your doctor or ask a medical professional what you can do, all right, to deal with them. If you're worried about cancer coming back, speak to your doctor honestly about that, right? And discuss with your doctor what you can do to reduce the chance of cancer coming back, right? And so you do what you need to do to reduce the risk of the cancer coming back. That helps you to manage your fear, help you to gain control over your future health. All right. You still have to be open with your fears, and your loved ones, they'll be there to help you. So do express your fears to your family, your friends. Be open, and you can also consider talking and expressing to other cancer survivors, all right, who have gone through the same, who understand what you're going through. All right. Also speak to a mental health professional, counselor, or psychologist. How else to cope better? All right. So often we may need some time to grieve over the loss, right, that we face in cancer. We talk about loss, we talk about the loss of some aspect of our body, all right, that has come through the cancer. But also, while you let yourself grieve, you have to also learn to refocus on the ways that cancer has made you a stronger person. You have survived cancer. So remind yourself that you have had what it takes to survive. All right. What are some of the strengths that you had, all right, that in you that help you to go through this process. All right. There may be some scars of the cancer treatment, but you have to realize that you're much more than that. To tell yourself, remind yourself to feel confident regardless of any changes of appearance. And when you can feel confident, you do look confident, you do look better. All right. And we talk about loneliness, it's common. It's important not to deal with it alone. All right. So, for example, you can join a cancer survivor group with other cancer survivors who have gone through the same ordeal. Last but not least, do keep a healthy lifestyle, right? Keep a healthy diet, stay fit by exercising, right? Keep active and engaged, right? Keep yourself busy. Do things that you find are meaningful, all right? Or some things that you enjoy. Continue with your hobbies. Take out something new, learn something, go for new experiences that will help you feel more occupied emotionally and mentally, all right? And this can also help you to take your mind off the fears. Also, do what are the important things to keep yourself healthy, to such as attending your medical appointments, taking advice of your doctor seriously, right? And seek help from your doctor or some mental health professional if required. All right. So with that brings me to the end of my talk, and thank you, everybody.
Thank you, Dr. Lim. Even the most resilient of all cancer survivors may inevitably experience elements of fear, stress, anxiety, or depression during their treatment and remission journey. It is therefore important to learn how to address and cope with them so as to keep well. Again, just to remind everyone that the information shared in this webinar forum is intended for general use only. Any resources, product, or service mentioned is solely for reference and to aid understanding and does not constitute endorsement or recommendation. Please consult your doctor or healthcare professional for personalized medical advice relating to your condition if you need.